Dr. Sadi, please start your recording. Okay,
Bismillahirrahmanirrahim.
Bismillahirrahmanirrahim. I would like to welcome everyone on board. And this is a great moment for the Department of Community Medicine. And on the behalf of the Department of Community Medicine and as a Dean of Faculty of Public Health and Preventive Medicine and Head of Community Medicine, I would like to congratulate Dr. Mehreen for her brilliant success. She passed all her examinations in first attempt and did her FCPS in community medicine. And she is a very dedicated, committed, and hardworking student. She has not only made her mark in academics, but also she was a very good researcher. She has published in impact factor journals during her stay in community medicine department. She has many tips for the other students because I believe that each and every student in the Department of Community Medicine is a brilliant person who is doing the best and who is contributing to the goodness and is progressing to achieve the goals. And the goal is of the professional development, of enhancing their capabilities, of determining their research aptitudes, as well as to make a mark in academic excellence. Each student has made a progress in these years and time, and they have shown their talent, their aptitude, and their dedication towards a greater commitment that is service to the ailing humanity and increasing their research capabilities. With these words, I welcome Dr. Mehreen Nasser, and then this house will be open for question and answer session so that each and everyone can ask as many questions as they can. So I would like Dr. Mehreen Nasser to please start your presentation.
Assalamu alaikum. First of all, I would like to thank my supervisor, Professor Saira Afzal, for constant support and excellent academic environment. What I am today, it's all because of you, ma'am. So let's start the presentation for part two. It's a role of constant motivation, and you have to study throughout your years. And for that purpose, we used to have the daily classes at King Edward Medical University, which were very helpful in examination. So next slide, please. So exam is divided into three parts, basically. For written exam, it's combined, but all three parts are included. And in Viva, there are three tables. The table one has epidemiology, biostats, demography, and ethics is also included in the table one. For epidemiology, there are many books, but I focused on Leon Cordes, CDC, and Dr. Bushra's book. And for biostat, it was Blumen, Dr. Bushra's book. And for research, I did from it research by Professor Saira Afzal. And for demography, I did Ilyas Park and Dr. Bushra's book. So this was about the table one. For the second table, it consists of health system. For that, I noted all the topics which are part of health system, and I have mentioned the reference books for all the topic. It consists of health policy, health planning, health system, health economics, health financing, hospital management, primary healthcare, health management information system, evaluation, health sector reforms, human resource management. And next slide, please. Quality, leadership, community participation, governance, and stewardship. I was very lucky that I did cover all these topics throughout my training. So it was easy to go through them during the final revisions. And the last part of is the third table, which consists of other and miscellaneous topics, which include communicable diseases, non-communicable diseases, health education and promotion, nutrition, environmental and occupational health, the preventive medicine, including OP, speed, adolescent geriatric medicine, global health, including SDGs and international health regulation, hospital waste management, and disaster. And next slide. The key to success is daily presentations, multiple revisions, because we have to mention all the points. So we need at least 5 to 7 revisions before going to written exam and viva examination. And past papers were helpful, and mock exams were also conducted by fellow colleagues, so they were also very helpful in refining the answers to the questions. Thank you.
Okay, thank you very much. Now, my first question is from Dr. Mehreen. Dr. Mehreen, how much research was there, and how your research aptitude and writing research papers have helped you while you are preparing for your examination?
Ma'am, research was very helpful in answering the questions. In written examination, we also got a question from research, and on table viva, we were asked about consort guidelines, which are for the qualitative study. So that short book written by you was very helpful in answering all the questions. And doing research practically was very good to answer the questions practically. Mentioning the limitations and all the things was much easier.
Thank you very much. I think all the students should ask questions, and they can even write in the chat box.
Ji, Assalamualaikum, Mehreen. I have one question to ask. What do you feel? How much time dedicatedly required to pass or to study for written exam? Thank you.
I used to study 5 to 6 hours daily for approximately 5 months.
Okay. So 5 months minimum time is required.
5 to 6 months, yes.
Okay, thank you. Any other question?
One question, please, Dr. Mehreen. My question is that if we are studying the standard books like Leon Goddess and K. Park and Ilyas, and we have not read yet the books that are more extensive like Blue Man and Andrew Green. So can we do selected topics from that books, or it is necessary to read all the book in detail?
We can do selective topics. Actually, Dr. Bushra's book has covered the topics from all the books, and your Green, she has also covered tables from Oxford and Maxi. So, it's difficult to understand that book by just seeing the tables. So you have to you can search from Google to understand the topic, or you can read the reference book for better understanding.
Thank you.
Thank you so much. We have one question in the chat box. That is, how much time is by madam? How much time is required for mock exams? Mehreen?
For mock exams,
Yes.
Mock exams, 1 month, they were conducted after passing my written examination. So that was only 1 month.
Okay, can we have a planning for the mock examination in our department for all the candidates, not only of FCPS program, but also the other programs, and also inviting other examiners as well as the candidates who are participating in various programs and they are giving exams for mock. So how would that planning it should do you think it should be after written examination, those mock examination would be more helpful, or we should try to plan on quarterly basis every year, etc.?
Ma'am, we should try to plan them on quarterly basis every year because they are very helpful. And during that exam, you go through all the books for the examination, and multiple revisions is the key to success in the examination. So it would be great if we plan the course mock examinations during the training.
Thank you very much. I think as we have for undergraduate, we have monthly assessments. We should conduct a mock examination in our department on quarterly basis, as well as written assessment on a monthly basis. We would do that, inshallah. I think there are other questions in the chat
Yes,
box.
ma'am.
Dr. Sadia, would you please
Yes, ma'am.
like to
Yes.
ask those questions?
Yes, ma'am. It is a question for you, Dr. Mehreen, by Dr. Awais. Is there any previous exam data available?
Previous past papers are available.
Okay.
But those are short essay questions. But recently, I've heard that they are changing the pattern to MCQs. So previous past papers are available, and I did solve past papers for the last 5 years.
5 years would be enough. Okay, thank you
Yes.
so much. One more question from Dr. Naila Bajwa. She's asking which topics are to be covered from Maxi?
Maxi is good for a health system. It has 5 to 6 chapters for different topics, including leadership, policy, and I've mentioned those in the other system table too. I've meant in the reference for the topics in which there are chapters in available in Maxi. I've mentioned them. And it's also good for the table 3, which was the communicable diseases, non-communicable diseases. Occupational health is very good there, and environmental health as well.
Okay, thank you so much. Any other?
Thank you very much, Dr. Mehreen. I think there are no other questions in the chat box. I want to reiterate very important thing is that once we have to go through all the topics in our daily classes, then on monthly basis we must have some written assessment. Then on quarterly basis we must have some mock examination, and from from FCPS program we must one coordinator from MPhil program, one from PhD program, and one from MD program, just like other programs. And we should ask them to conduct the mock examination on quarterly basis for their respective programs, and that would increase the preparation of our students. And other students, if they want to join in, we would welcome them, because recently all those students who have passed the community medicine examination, they have given us a very good feedback of our daily classes. So this the founder of these daily classes, the founder coordinator is Dr. Mehreen Nasir. So you have gained that important applause and important feedback, that these have not only helped you to build your knowledge, but also this sharing of the knowledge has helped to build up the community and other people, and they are able to achieve their goals. And now these classes, they are being conducted very successfully by the help of Dr. Sadia Rafiq and Dr. Amber. They both are doing a wonderful job. Most of the classes are being coordinated by Dr. Sadia. And after that, having said that, the second person who is in charge of these classes is Dr. Amber, and all these students, they are contributing to it. And I have never seen a single student has missed any class or has missed any topic, etc. And by this hard work and dedication and their commitment, inshallah, they all would be able to pass their examination in first attempt. The second important thing is the checkpoints or the assessments. Yes, we have to do more work on assessment and more work for mock examination, as we have lots and lots of workshops that are available on different topics, and we are calling our faculty members from all over Pakistan. Similarly, we can conduct exams that are the mock exams, and we can ask many examiners who are present to please come and contribute in the learning of our students and in assessment of our students, so that the third party evaluation can be done. Another important thing is that we are very lucky that very senior teachers in community medicine, they are regularly visiting our department, either due to workshops or due to exams. So we can ask them for the mock exams too. So we are lucky that the first Dean of Public Health and Preventive Medicine, Professor Moz, the associate professor when this university came into being, and later became the professor of community medicine, Professor Shahid, and professor of community medicine in CMH, Professor Ashraf, Professor Aisha Humayun, who is a great pillar of research and academic activities in Sheikh Zayed Medical College, and a big sport of academic activities in King Edward, Dr. Zarabia, who is in Fatma Jinnah Medical University, and many other people, Professor Seema Daud from LMDC, Professor Seema Hasnain, Professor Aisha Humayun. Most of them are our examiners, as well as our members of Board of Studies and part of Board of Faculty. So we would call them and request them to please come and contribute in mock examination, and that would be a great step forward. So thank you very much, Dr. Mehreen, for your time, and inshallah we would sit together and we would have more interactive discussion to make academic programs more towards excellence, so that each and every student get maximum benefit from this learning environment. Thank you very much, Dr. Mehreen, for your last comments, please.
Thank you so much, ma'am. It was a wonderful experience doing training with you. I have my research articles, and I have passed my exam with ease. It's all because of you, ma'am.
Thank you very much. It is Allah's blessing that people who are hardworking, dedicated, like you and like each and everyone, if I start naming, there are so many names now in all our programs, very brilliant and good people. They are here to motivate each other, to help each other, to support each other with very positive attitude. I'm so happy that all are so helpful, and they are so positive, and they have become the eyes of this department, and the department that I must salute Professor Mir. She is the founder of this department, Madam. She started this department, and at that time she has some dreams. I must say that those dreams are fulfilled by these students who have progressed so well. So Madam Zahida Sultana Mir would be very happy. She in heavens she must be smiling at the progress of this department of community medicine that started from few rooms, has developed not only in infrastructure but also in human resource, and now most of the people, they are working all over Pakistan, either in Quetta or in Lahore or in Sindh, you can, or in KPK even, and you can name any province or